Hello, my name is Paige Williams, and this is my presentation of my interview with a healthcare provider in the women's health field, an advocate for women's health, Dr. Linda Sodoma. So, who is Dr. Linda Sodoma? Actually, she is the mother of my future mother-in-law, and obviously her name is Dr. Linda Sodoma. She's a doctor of osteopathy and a fellow of the American Congress of Obstetricians and Gynecologists, and she's also an owner of her own private gynecology practice in Gilbert, Arizona. It's called Life Care for Women. She received her Doctor of Osteopathy degree from the New York College of Osteopathic Medicine, which is in Long Island, New York. During this time and throughout her career, she's also had several prestigious fellowships, residency applications. She's had a lot of experience working in, underserved communities, especially for women's health. She's also spent over 30 years in the field. She started off as an EMT. She worked in nursing homes, medical assistant throughout her college career, and then she eventually earned that Doctor of Osteopathy degree. So, in women's health in particular, she spent over 20 years as an OBGYN. She's been working with Banner Gateway out in Gilbert, Arizona, and she's been part heads of surgery centers out there. She's spent a lot of time really dedicating her life to women's health, especially within the obstetrics and gynecology field. And just this past winter, she actually switched over to just gynecology as she really wanted to focus on this aspect of her practice. Dr. Linda Sodoma truly has a passion for women's healthcare. She kind of explained to me that her initial interest in OBGYN really stemmed from her curiosity in surgery. It's just something that really piqued her interest heading into medical school along with primary care, just because of the important role it plays in overall well-being, which is really the whole focus of osteopathic medicine. If people aren't familiar with that, it's more of a holistic approach to medicine rather than treating the one symptom. They try to take a holistic whole body approach, looking at how diets, sleeping habits, lifestyle changes might be affecting your health rather than just saying, okay, here's this prescription and get on with your life. The challenges too that come along with primary care and surgery also caught Dr. Sodoma's interest, especially as they relate to the health of women and children, because these are two very important critical areas of their health care. She also is just an extremely compassionate and giving person that really makes her a really amazing doctor and someone who is in a really good role to provide care and empathy to her patients. And it just really makes her a really good fit in this space within women's health care. And it kind of moves into her Life Care for Women practice in Gilbert. It is a private OBGYN practice. Some of the services she offers are birth control, pap smears, STD testing, hormone therapy, hysterectomies, IUD care in particular for birth control, and other gynecology services. She's also started doing some different anti-aging medicine, which is unique especially within women's healthcare, such as the body type sculpting and vaginal rejuvenation. One area that I think is really interesting, and I kind of brought up with Dr. Sonoma, I asked her what she thought of the over-medicalization of women's healthcare, especially as we kind of learned in the lecture from week 4 on women and reproduction, part 2, that infertility and hormone treatments have really been used as a way to over medicalize, and kind of viewing that like those whole processes of menopause and pregnancy as an issue, a health problem versus just a natural process. And she does agree with hormone therapy that it's not really a medical issue. It's not something that there should be all these prescriptions and therapies for. But for some women, the hormone therapies really do help them live more normalized lives. Some of them report really having improved quality of life with these hormone therapies, and given in moderation and given to the right people, they can be really effective in bringing about a higher quality of life. The patients that Dr. Sodoma primarily works with are all adult age groups, because she does delve into that anti-aging specialty as well. She does everything from hormonal needs for the hormone therapies for men and women, pelvic pain, bleeding, tumors, and other gynecology and anti-aging issues. She does work with patients who are on government assisted programs. She doesn't, there's no discrimination there. That she tries to work with these women. She sees them for the person they are and not for their ability to pay for their medical care. Why is there a need for quality OBGYN care? Dr. Sonoma explained to me that one reason she really chose to go into OBGYN and why she loves this field so much is because there was a really dire need for quality and safe care for women, as they go through the different parts of their lives. It allows them to be active members of society when they're healthy overall. A lot of her patients express how quality OBGYN services really allow them to be successful as mothers, people in careers, and that sort of thing. Especially for the obstetrics portion of her career, obviously having good prenatal, postnatal, perinatal health is really important for the health of the mother and the child before and after birth. And really, Dr. Sona also emphasized the importance of preventative care within her field because preventative care, especially for women's health, helps stop smaller, more manageable health issues from turning into these medical emergencies, which can really devastate someone's life and alter their kind of life course. In particular, certain preventative care actions such as pap smears, mammograms, and removing precancerous and cancerous like tumors and lesions. All of these allow the body to function more efficiently, which again is really important and kind of a mantra of the osteopathic medicine pathway. Resources for the OBGYN and the women's healthcare field that Dr. Sonoma works in, a major hurdle right now in resources is that lack of health insurance and it's just like gaps in coverage. So either an entire lack of coverage or the gaps. Particularly for women's health services. Here in Arizona, about 1 in 10 women receive their health care coverage through Medicaid, which is the government assistance program for people who meet income requirements. These programs are supposed to cover at a national level family planning and pregnancy related care, which would fall under that OBGYN category, but states are also able to kind of manipulate how much coverage is given for these areas, and usually they're rather lacking, which is why we've actually seen a lot of this in the news recently about states limiting, how much money they're giving through Medicaid and government assistance to family planning, pregnancy, Planned Parenthoods, things like that. Another really interesting thing to keep in mind, especially in regards to Dr. Sonoma's office, where Gilbert and Mesa, Arizona, 31% of low-income women in Arizona receive their healthcare insurance through Medicaid. So that's a large proportion of women in general living in Arizona, and they all, at some point, every woman at some point in their life is going to need some type of OBGYN care. So it's important that practitioners like Dr. Sonoma are operating in the community to provide these women with effective and safe, accessible care. And something that Dr. Sonoma brought up that was really interesting to me, I hadn't ever really given a whole lot of thought to, was how doctors really have to get creative to provide cheaper alternatives in a clinical setting so that their patients can still get the highest quality of care, because not every patient might be able to afford a whole array of prescription medications or expensive out of network that aren't covered types of procedures, but the doctors might be able to find a way to get them generic drugs. They might be able to find cheaper treatments that are that doctors are able to get covered by insurance for the patient. The way that Dr. Soma explained it is that when the doctors, write prescriptions or write to the insurance companies of why a patient needs a certain therapy, they have to use very specific wording to be able to get it considered for under insurance coverage, especially for birth control, hysterectomies. It has to be like portrayed, and almost usually it is, and it's portrayed as something that the women cannot survive without. That it is something that could be detrimental to their health if they do not receive that treatment. Something that I really admire Linda and for is her truly positive outlook in her field, because we all know, like, can imagine how stressful it would be to be a doctor, and especially an OBGYN, where you're on call 24/7. When you're on call, especially holidays, it doesn't matter. Like, when a baby's going to be delivered, when you have a patient come in, like, you're there by their side. Um, and Dr. Soma really cited the importance of helping others to be happier physically and mentally, helping them lead healthier lives, and regaining control of their futures as really uh, as truly rewarding aspects of her career. Especially just because I know Dr. Sonoma personally, she just has a very like bright outlook on life, and so I could definitely see how making others happier really is an important part of her career. And of course, a career like working as a medical doctor doesn't come without its challenges. Obviously, we talked about the lack of insurance within patients can really bring about an inability to do enough to help people resolve their medical issues, even ones that extend outside of their medical care, their social issues, because it's inevitable. Then people are coming to you with medical problems that, especially from a holistic osteopathic approach, that social problems outside, such as, low socioeconomic status, immigrant status, different social factors like that, are going to play a part. And doctors have limited ability in what they can do to change those, because that is something that has to happen on a more societal, governmental basis. And that's where doctors run into a lot of problems, especially when we move on to the idea that, it is hard to reach patients and really help them overcome their problems when they've come to the doctor too late. And it's hard to kind of fix something that's already going so far downhill. Something that's kind of interesting is I found an article by Janice Goodman, who conducted basically a survey and analysis of data regarding women who were pregnant. They were asked, if you started to experience postpartum depression, how likely would you be to go seek treatment, and what would you perceive as barriers to seeking that treatment? And she found that almost 65% of women cited a lack of time as a barrier to seeking care, while 33% cited childcare issues as a barrier. I could definitely see how that kind of mindset can be extrapolated to the population of women as a whole, because I feel like in general, a lot of women are constrained by social and family obligations, which they can perceive as barriers to treatment. You work, you go to school, you have kids. It's really hard to find time, or in your mind you say, oh, it's hard to find time for myself to go to a doctor and seek treatment for issues like that, until they become so severe that you have no other option. And at that point, it takes a lot more time and effort and money and resources to fix that issue than what if you had just gone when the issue first began. The childcare issue is also another interesting one, because obviously that impacts a lot of women across in the world. You can't always take your child with you to a doctor's office, or it's difficult. They're young, they don't want to sit still, that sort of thing. So really, that inability to find childcare is also really intensified by lower socioeconomic status, less resources socially and financially, because you can't really overcome those barriers of a lack of time or childcare. So why does all this matter at a societal level? The work of Dr. Sodoma and other practitioners like her in the community, especially OBGYN practitioners, people who are working at clinics such as Planned Parenthood and women's health centers throughout the community. They're really the first line of defense in promoting and recognizing the social and healthcare needs of women in their community. So they are going to be the advocates for their patients. They're not just there to make a buck and go home. They're truly there for their patients. And so they really will advocate for the needs for them, whether they're able to take a public, political platform, or whether they just are able to provide these services with, efficacy and empathy within their communities. And I really think that work like that is basically helps women bring about higher health status and improve their life trajectories. Practices such as that of Dr. Sodoma is a good model for how community interventions and community practitioners for women's healthcare really could be the key to empowering, improving women's health status rather than large governmental reforms and policy developments. Just because these processes take so much longer and there's so much political firestorm around them that it really is, it takes so long to bring about change that in the time it takes for something to be brought about, women are already suffering from poor health. Um, Doctors such as Dr. Sodoma recognize the importance of preventative care, which has also always throughout any public health discourse, women's health care, the importance of preventative care and how much easier it is to provide this preventative care rather than curative and strictly biomedical approaches. Really do make a difference and bring about better health status for women, especially that holistic treatment. Um, and overall, I think just all of those things together really empower women and help bring about better health for women globally. For me, the important takeaways from my interview with Dr. Sodoma were that the true value of a holistic approach to medicine, especially for women's health, because I feel like as women, I know personally, like we'll tend to go to the doctor and say, oh, we just want a prescription or, fix this one problem. But we really should sit down and analyze how our diet, our lifestyle choices, and how stress affects our lives to better understand how our health is really impacted and what we need to do to live a healthy life. It's also important to understand the challenges faced by practitioners and their concerns because they do talk to they are talking to the vulnerable populations of women in the U.S. they're going to be able to advocate for their needs and they're going to be able to let us know and inform good policy development. They also can let us know about the need for empowering local women's health providers and the allocation of resources to really encourage preventative care sources. This would mean allocating more money, maybe governmental aid and incentives to provide preventative care at local clinics rather than making women travel to urban clinics that are out of their reach for these types of services. I think it's also kind of demonstrated to me the importance of social factors on women's health, kind of from that holistic approach, such as like socioeconomic status within the U.S. That's really important. I mean, we all kind of know how education and income can really affect your standing within society, and your access to medical care is really important. Something that really inspired me for coming out of this interview is that I've always had the hope of attending law school. I really want to work as a healthcare lawyer. And the reason I'm really interested in this field is just the potential to help people, especially women in healthcare. I feel like as a healthcare lawyer, you can work with patients, practitioners, community sources, and programs, and also kind of the flip side of the medical industry with pharmaceutical and biomedical companies. I feel like this is important, especially for the pharmaceutical and biomedical companies, because we saw in the TED Talk with Alison McGregor how women have largely throughout the history been neglected in FDA clinical trials of drugs. So basically all the drugs are tested on male cells. They're tested in male subjects because they've always been so afraid of how these drugs might play out in women's ability to have kids or, their fertility. But yet again, on the flip side, they are, prescribing these medications to women, and they don't know the side effects that, how they're going to bring about, what they're going to bring about in women, while our bodies and physiology and anatomy are so different. So I think really working and advocating for that difference and that representation of women in studies of pharmaceutical, the need for pharmaceuticals and biomedical devices, techniques for women, specifically for our unique medical needs, is something that I could see in my future, and I really hope to have a future in that area.